Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Well Woman Wednesday, where we've been talking about sexually transmitted infections. Today I'm going to be telling you all about HIV, how you get it, how you don't get it, and what you need to know to take great care of yourself. Make sure you keep watching. All right, ladies, let's jump into this topic. HIV is one of the most widely studied sexually transmitted infections, and we have been studying this because it has killed so many people over the course of time. So where did HIV actually come from? So HIV has been linked to SIV. SIV stands for simian immunodeficiency virus, which is actually found in a certain type of chimpanzee in Central Africa. So it's thought that probably in the late 1800s, this virus mutated to the point where it could be transmitted to humans. And that's where we got HIV, or human immunodeficiency virus. This is an important virus to know about because it can cause AIDS, or acquired immunodeficiency syndrome, and that can be deadly. We know that HIV and AIDS have killed people all throughout the world, and certainly in the United States, and particularly in men who are sleeping with men. So HIV first became widely known in the 1980s. And you know, I'm an 80s baby, so I remember all the fear and the stigma around AIDS. And my dad is a dentist, and it seemed like dentists were getting HIV and progressing to AIDS. And so people were afraid to go to the dentist for a while. There were people dropping like flies from this disease, especially in the gay community. And so everyone was afraid. No one really understood what it was from and how it was happening. And so there has been a lot of work, research, and study that has been put into HIV and understanding how HIV progresses to AIDS. So today I really want to hit on some important topics with regard to HIV. And again, HIV stands for human immunodeficiency virus, and it is a sexually transmitted infection. Particularly, receptive anal sex is the highest risk for transmission. So this is men who are having anal sex, women who are having anal sex. If you are the receiver during anal sex, your risk for getting HIV is actually the highest. HIV can also be spread through vaginal sex, but it's not as often spread as it is from anal sex. Oral sex rarely results in HIV infection. In addition to sex, HIV can also be transmitted through IV drug use and sharing needles and other drug paraphernalia. Back in the day, before we were really very aware of HIV, it was also transmitted via blood transfusions. HIV can be transmitted from mother to baby during pregnancy, and so treatment of HIV infection during pregnancy is absolutely essential. And that's one of the reasons that pregnant women are screened for HIV as soon as they present for their prenatal care, and also at the end of the pregnancy prior to giving birth to their baby. Some other interesting routes of transmission that I found in my research was that pre-chewed food can also rarely result in HIV infection. So when moms or dads are chewing food and then actually transferring it to their baby or their infant's mouth, that can cause transmission of HIVs, particularly if that individual has gum disease or ulcers in the mouth where that food is coming in contact directly with their bloodstream, and then they're actually feeding that food to someone else. Like I said, oral sex rarely results in HIV infection, but certainly if there is ejaculation of semen into the mouth, that is a much higher risk. If both individuals have gum disease and they're doing deep open mouth kissing, that also can be a risk. And so while these are not necessarily the most common ways that HIV is transmitted, they are things that we need to be aware of and watch out for. Now, let's talk about how you don't get HIV, because there was lots and lots of stigma about touching people who have HIV, being in the same room with people who have HIV, living in a house and maybe sharing a bathroom or sharing dishes or forks or other eating utensils with people who have HIV. These have been found not to transmit HIV at all. Closed mouth kissing, touching, hugging, shaking hands, those do not transmit HIV. Toilet seats do not transmit HIV. So these are some of the things that there was a lot of fear and stigma surrounding that we now know that we don't even need to be worried about. If someone coughs in the room with you or sneezes, that does not transmit HIV. So stop the stigma. Don't be afraid to live with, be friends with, be around folks with HIV, because most of our daily activities are not going to transmit HIV at all. There is no need to treat someone living with HIV like they are a leper. The only way to know that you have been infected with HIV is to get tested. And like I've been saying throughout this series, knowing your status is so important. If you are not involved in a committed monogamous relationship, I recommend getting tested at least every 6 months. And certainly if you think that you may have been exposed to HIV or any sexually transmitted infection, get tested. Get tested on a regular basis. If you are involved in a monogamous relationship and you have any doubts, or if you are just going for your annual physical, I recommend being tested. And certainly if you are pregnant or planning to become pregnant, testing is key. So let's walk through the stages of HIV infection. So if you've been following along and you caught this video here on syphilis, you know that there are multiple stages of syphilis. Well, HIV is the same. So with primary HIV infection, like within the first few weeks of being infected, you can experience fevers, chills, fatigue, body aches, muscle soreness. And what does that sound like? Like a cold or flu, right? These are very non-specific things. You might have swollen lymph nodes or a sore throat. And so these are things that most folks would not just automatically equate with HIV. But if you know that you're having unprotected sex, or that you maybe, had a hookup here or there, you may want to consider, this is interesting. A few weeks ago, I had this high-risk encounter and now I have these symptoms, and get tested. The initial part of the infection, the virus is replicating itself over and over again. So you have what's called a very high viral load. And that basically just means there's a lot of virus floating around in your bloodstream. And this initial portion of the infection is when you are highly contagious. And so if you have not been treated, or if you're not aware of your infection, you would then move on to the second phase of HIV infection. So the secondary phase is usually completely asymptomatic, and the virus is making copies of itself in your bloodstream, but at a much lower rate. So your viral load, or the amount of virus in your bloodstream, is actually pretty low during this stage. Now, this stage can last up to 10 years without treatment. Most folks who have secondary HIV infection are not aware if they're not regularly going in to be tested. While the virus is at low levels in your bloodstream, you are still certainly able to infect others and transmit HIV. As phase 2 comes to an end, the CD4 or T helper cells, which are vital to our immune system, are being destroyed. And as those cells drop in our bloodstream, we are at higher and higher risk for what are called opportunistic infections. And opportunistic infections are infections that we otherwise would not get if our immune system was healthy. And so that leads us to stage 3 of the HIV infection, or AIDS. AIDS, again, stands for Acquired Immunodeficiency Syndrome. And AIDS is defined by having a CD4 cell count of less than 200, or having an opportunistic infection. And so these are the infections that you hear about: people who have AIDS-related pneumonia, people who have AIDS-related skin cancers like Kaposi sarcoma. This is the stage that we are most concerned about, because this is where People can die from infections that normally would not bother them at all if they had a healthy immune system. Now, there's a lot of confusion about HIV versus AIDS. And so let's clear that up. HIV is the virus that leads to AIDS. And once you have a diagnosis of AIDS, either because you have one of these opportunistic infections or because your CD4 count has dropped below 200, then you are diagnosed with AIDS. And even if you get treated and you're able to get your CD4 cell count back up, or you clear out that infection, a diagnosis of AIDS sticks, it stands. And so once you have gotten to that point where you've had AIDS, the diagnosis remains AIDS. Hopefully you're able to get treated, get your CD4 cell count back up, and get rid of any opportunistic infections. When you have AIDS, you have a very high viral load. That means that there's lots of virus floating around in your bloodstream. And this is also a stage where you're contagious, just like stage 1. In someone who has been diagnosed with AIDS, if they are not treated and carefully cared for, their average survival is only about 3 years. So it's so important that we're not in denial about HIV and AIDS, because treatment can keep you alive, and people who have HIV can live very long, healthy lives if they're treated. So let's talk a little bit about treatment. There are a multitude of medications that are now out there, and even prevention medications. So if you are a man sleeping with a man, or if you are a woman who has a known HIV positive partner, PrEP therapy may be right for you, and this is something that you should discuss with your healthcare provider. PrEP therapy is actually therapy that's taken in order to prevent someone from contracting HIV from their partners, whether that is a monogamous relationship or non-monogamous relationships. PrEP therapy can be very useful, especially for men who are sleeping with men, or folks who know that they have an HIV positive partner, and that can protect you from getting HIV. I hope today's video was helpful for you. The moral of the story here is know your status. If you find that you're HIV positive, get treated. Treatment can help you live a long, healthy, fruitful life, still pursuing all of your passions. So denial is not our friend here. Knowing our status, getting treatment for HIV infection, and getting treatment for prevention of HIV infection if we know that we are in a high-risk category can also make all the difference in the world. If this video was helpful for you, give me a thumbs up. Make sure that you subscribe so you don't miss a single Well Woman Wednesday, and I'll catch you next Wednesday, girl gang. Peace.